Hello everybody, my name is William Rojas, and today I'm going to be doing a presentation on patient medication, pre-medication, contrast for CT, contraindications for CT, as well as some anatomy of some CT photos. So continuing forward, we have the CT of the chest here with and without contrast. And the big giveaway for the CT chest, whether or not there's contrast, is the aorta. If you look at the descending aorta in the photo on the right with contrast, you're going to see that it's actually bright and standing out against the anatomy around it, whereas compared to the left, it's a similar gray. There's no clear definition to where it begins and ends. So moving forward, I have it labeled at the top. You can see on the one without contrast, I labeled sternum. With contrast, I labeled a few of the key functions of the heart. We have the right pulmonary vein, the descending aorta, superior vena cava, as well as the right auricle. So let's move forward. We have a CT of the abdomen here. Again, our little cheat lets us know that the one on the right has contrast in it. As you can see, the aorta is standing out against the flesh around it, and it's a very bright white. So as you can see, I have labeled the stomach on the top, gallbladder below the liver, as well as the spleen. So let's keep moving forward. We have a CT of the pelvis with and without contrast. Now, a lot of the times, a CT of the pelvis is going to be done in conjunction with the abdomen or the abdomen with the chest. It's pretty rare to see just a CT of one area. But moving forward, we can see here we don't have the aorta as clearly as we had in the others, but there are some other indications that this is going to be a one with and one without contrast. As you can see, looking for the anatomical structures, they're much more clearly defined with the one with contrast. So we're going to look at the labeling. We have the descending colon on the left without contrast. We have the abdominis muscle, which is visible in both, but the difference is on the level of the slice. On the one on the right, we have the linea alba, which could be visible on an image without contrast, but this one is just shot a bit lower, so I saw fit to label it. We have the gluteal maximus muscle, the ilium, as well as the psoas muscles. So moving forward, we have a CT image with and without contrast of the brain or the head. As we're looking through here, we could see on the one on the left without contrast, we have the clinoids of the sphenoid, as well as the pituitary gland hanging off right close to it. We look at the one on the right with contrast, you're going to see there's more cranial definition of the brain. We see more of the folds, and I have it labeled. You can see the pons in the middle there. We have the left and right hemisphere. Moving forward, we have the abstract of the presentation, which is the purpose. We're going to discuss what kind of quality control means as a tech, why we check prescriptions, the importance of CT anatomical anatomy, the importance of pre-medication, and the dangers and risk associated with that, as well as some reasons why we wouldn't perform CTs. Moving forward, we have the importance of medication. As a CT tech, you're going to be working a lot with contrast, and contrast is very, very important that we know what the patient is prescribed. Most medications, most diabetic medications have some contraindications for CT contrast. So you want to inform that you want to check the patient's prescriptions, make sure there's no diabetic medications because they interact with how the kidney functions, and you can have some serious nephron damage if we do not instruct the patient to avoid taking diabetic medications for 48 hours following the contrast procedure. So we're going to check that. We're going to make sure that everything is fine, that we don't need, the doctor hasn't ordered any pre-medications or anything like that, but that's for a different slide. Let's keep moving forward. Pre-medications for contrast, like I was just talking about. Pre-medications are advised for patients who maybe have tendencies to not act up during studies. Some patients rarely will be prescribed something to calm them down because they don't do well in enclosed spaces. That's not unheard of. There's also some health risk associated with the contrast, and so if we have any reason to believe that the patient might have an allergic reaction, we might just give them preemptively some antihistamines, maybe Benadryl, anything to kind of alleviate the symptoms of the contrast affecting the patient. So moving forward, by the way, the referring physician decides if it's prescribed or not. You can raise alarms and such as a CT tech, but the ultimate call is to the physician. The physician you cannot ever give medication if it's not prescribed. Pre-medicating them with like certain antihistamines and stuff like that. Moving forward, we have contraindications for CT. So if you're pregnant, the dose of a CT scan is significant enough that it'd be a risk to the child. So it would be advised against early pregnancies to give a mother CT unless it's absolutely necessary. Young age, again, a young patient, very susceptible to radiation. We don't want to expose infants, infantiles, anybody who's very susceptible to radiation damage. Maybe people who are claustrophobic, who don't feel safe inside of the machine, or it's too loud, and they physically just can't handle the idea of being inside of a CT machine. Those are some other outside medical reasons. One in particular could be, again, contrast. Contrast is very important to CT scans, and it's very often done. So we have to be very careful when we use contrast on certain patients. Like we said before, if anybody with impaired kidney function is at significant risk to these contrast studies. So we want to make sure they have functioning kidneys. They don't only have one kidney. They don't have, let's say, diabetic medication that we don't alert them not to take. Things like that. Or maybe allergic to the contrast. Just we have to be very careful with that because the contrast will seriously injure the kidneys if we don't take these things into consideration. And last, and I believe finally, we're going to go over some CT accessories. We have 3 here that I decided were pretty important to talk about. One was the power injector. During certain studies of CT, it's important that we have a continuous strong pace of contrast being injected into the veins. This is normally done for something like a CTA where we want to reconstruct the arterial structure of the body. I have some understanding of it, but I would need to do more referencing studies for it. But it's a very important tool, and I've seen it used multiple times when I was shadowing my CT tech. Following on bed straps, again, certain patients need to be restrained, perhaps a child or the patient with their consent. We do not want the patients moving through CTs, even though the CT scans are very brief, very fast. Some patients have struggle with staying still. Finally, we have the head holder. The device is very useful for minimizing the patient's need to move their neck or anything like that, and it helps keep the head stable, and we get good images. And 1 second. And then I just wanted to say thank you guys so much for listening to our group presentation. Have a great day. That's all.